Can the CEA tumor marker test guide colon cancer treatment? Can the Carcinoembryonic Antigen tumor marker test guide colon cancer treatment? This is an important question for many facing a colon cancer diagnosis. The CEA test measures a protein that can be found at elevated levels in the blood of some colorectal cancer patients. While it can provide valuable insights, it is not used in isolation for diagnosis or treatment decisions. First, let's talk about how the CEA test is used. Before starting treatment, doctors measure CEA levels to establish a baseline. After surgery or treatment, if CEA levels decrease, it generally indicates that the treatment is working and the cancer burden is reducing. On the other hand, if CEA levels rise or remain as high, it may suggest that there is still cancer present or that it has returned. After treatment, regular CEA testing is recommended to monitor for any signs of recurrence. Guidelines suggest testing every 3 to 6 months for the first 2 years, then less frequently up to 5 years. If CEA levels increase during follow-up, further diagnostic imaging may be needed to investigate the possibility of cancer returning. For patients undergoing chemotherapy for locally advanced or metastatic colon cancer, measuring CEA levels over time can help assess how well the cancer is responding to treatment. A decrease in CEA levels during treatment is a positive sign, while an increase may indicate that the cancer is not responding as hoped. However, it is important to note the limitations of the CEA test. Not all patients with colorectal cancer will have elevated CEA levels. Additionally, false positives can occur due to benign conditions or other types of cancer. Therefore, a single CEA measurement is not very accurate on its own. Instead, looking at trends over time provides more useful information. Imaging studies are still crucial for confirming any suspected recurrence or progression indicated by changes in CEA levels. Major oncology guidelines, such as those from the National Comprehensive Cancer Network and the American Society of Clinical Oncology, recommend using CEA testing as part of a broader approach to managing colon cancer. It is essential that CEA results are interpreted alongside clinical findings and imaging studies. In summary, the CEA tumor marker test can be a valuable tool in guiding colon cancer treatment. It helps evaluate how well treatment is working and can detect recurrence early. However, it is most effective when used in conjunction with clinical assessments and imaging. Patients should work closely with their healthcare providers to create personalized testing schedules and ensure the best management of their colon health and cancer care.